My role today was to update on the epidemiology of the COVID-19 issue, and particularly the Victorian wave that's dominating the numbers that we're seeing each day and the trends that have happened since our the last time we met as National Cabinet. Of course, Victoria is not alone in this. There are small numbers of cases, many of them related to Victoria, in neighbouring states, in South Australia, in Queensland, and particularly in New South Wales. There are only two jurisdictions without active cases at the moment, ACT and Tasmania. So those increasing numbers, what can we see from those? I shared that with the Premiers and Chief Ministers in our hookup. We can see an increase in elderly, particularly those over the age of 80 and 90, and that reflects what we are seeing in aged care outbreaks in Melbourne in particular. But still the vast majority of cases are in that young age group, and this is really an important issue for us to consider in our community engagement strategies right across Australia. What are we doing to engage with our youth to make sure that they know that this is not just a disease for elderly people? That might be where we're seeing the deaths, and that's very tragic. But young people are getting infected, young people are transmitting the virus, and young people sometimes are also experiencing the severe end of the spectrum of the disease. We talked a little about the Victorian measures and our confidence that we have that what is happening in Victoria, particularly in relation to movement and mixing restrictions, so the lockdown measures will be effective. We saw that that was effective during the first wave, and now with even stronger measures that have been introduced over the last week, they will also be effective, but not immediately. There is always a lag time of 1 or 2 weeks for any of these things to show what is happening. That's the nature of this virus. As the PM mentioned, we talked at some length about aged care, and I was very happy to see the commitment from all of the First Ministers to work very strongly and closely with the Commonwealth in relation to aged care, particularly in preparation and prevention in states outside of Victoria. So, as the PM has mentioned, there's a lot of assistance going to Victoria right now. That's a major issue for them, and we have this new concept of the aged care response centre that has been set up so that literally we have people in a large room but together from all of the agencies that are working on that issue right now, from the Commonwealth, the emergency management area of the Commonwealth, as well as health officials, the ADF, our AUSMAT teams, nurses and other workforce surge capacity that's come from other states. Crucially and very importantly and very good engagement from the Department of Health and Human Services in Melbourne, as well as their Emergency Management Victoria. So the sector itself and concentrating on communications, on workforce and particularly the surge in workforce, and on infection control. So we talked through that at National Cabinet. What would it be like if that was to happen in each of the states, and a really strong commitment to audit where we are now everywhere through the aged care sector so that we can be preparing for that, look at preventive activities, further training that may need to be required, for example, and particularly that response, that acute response phase, so that would be ready to go if this happened, preparing for the worst, hoping for the best. In terms of vaccines, I think, as the PM has said, there is really strong optimism here. We can't promise that there will be a vaccine or when it may occur. We've never had a vaccine for a coronavirus in the world before, but the very best minds in the world are concentrating on this. Many companies, well over 100 different types of vaccine that are in development, and many of those are already in clinical trials in what has been described by some as warp speed. So these things normally take years. This is taking months, even weeks, to get through this. In Australia, we're very prepared, and as the PM has mentioned, those prongs, the things that we're looking at very specifically in relation to research and development and support there, not only for researchers here in Australia, but also through international bilateral and multilateral relationships. We're looking very, very clearly and carefully about purchasing and advanced purchasing options as well as local manufacturing options. We're looking, of course, at the regulatory aspects to make sure that whatever does become available it works, as well as being of high quality and, of course, being safe. And all of these things are very important in the coming months. But I'm very optimistic that we are well placed here in Australia, not only to contribute to that worldwide effort, but also to benefit from it. And it just strikes me that whilst we are concerned, of course, about what's happening in Victoria right now and in other parts of the country in relation to COVID-19, I think it's worthwhile remembering where we've come from in these few months. So in January, this was a new virus. We didn't know anything about how we might develop a vaccine. Now we have vaccines in clinical trials and developing well, showing that they work and that they're safe. We've had rapid development of testing capability in our laboratories here in Australia and around the world. Our public health capacity has been increased and improved, and we've seen particularly a very well-developed plan to know when things are needing to be further developed or responded to. Huge amounts of stock coming into our national medical stockpile, not only personal protective equipment, but also life-saving drugs that we now know can work against this virus. We've had an increase in our hospital capacity through the private health hospitals in particular, but also through training and purchase of ventilators, for example, in intensive care. We've got telehealth that's available right throughout Australia. And so there is a lot that we can be confident about, that we are prepared and indeed using those capabilities right now in Victoria, and particularly in aged care in a very coordinated and supportive and responsive way.